Well, let's talk about this with former Conservative Health Minister Lord Bethell. James Bethell was served as a Health Minister. Good morning to you.
Good morning, Julia.
Thank you for joining us. Look, let's talk very briefly, if we can, about just reaction to that. Just as a normal human being, as a father, to just the horrors of what has happened there, and the words of the judge, and indeed the words of a family member saying this is a final act of wickedness from a coward. What did you make of the decision of Lucy Letby not to appear in court to have that final sentencing?
Well, the sentencing was incredibly moving. As you say, I've got 4 children, and I know how vulnerable you feel when you literally surrender your child, when it's this tiny little screaming bundle to the nurses to be taken away. And for the first few days of a child's life, of course, they spend a lot of time away from the mother and away from the parent. And you need to trust the organisation to look after them well. And in the vast majority of cases, of course, that works really well. That's the best way of looking after babies. But to have a nurse like that, so malevolent, so sadistic, and so cruel, taking advantage for some bizarre reason, I think really strikes anyone who's been through that experience to the heart. And I feel so badly for the families involved. I mean, I think everyone feels in their pit of their stomach such sorrow about what's happened.
Well, absolutely. And sorrow is all very well. And we have this after terror attacks as well, where everyone lights a candle and says, Kumbaya, and we all, say, never again, lessons will be learned. And then, of course, it happens again. And this will happen again. It's a rare occurrence. We know that. But the key thing is, we still saw the loss of police think could be that 30 babies were attacked. It's a matter of luck that more babies didn't die. We know that she was sentenced for murder of 7 babies, attempted murder of 6 more. Still no verdicts on 4 of the babies, and not guilty on another 2. I mean, those parents left in horrific limbo as well. But the concern a lot of people will have right now is, what are we going to do to make sure this can't happen again? There are always going to be sadistic, psychopathic, narcissistic, terrifying people who will try and do horrible things in whatever walk of life. The question is whether it's a sex-abusing priest, whether it's a charity fundraiser like Jimmy Savile, who goes into hospitals and sexually abuses and rapes, whoever it is, whether it's a killer. We need to know that there are safeguards so that when bad people present themselves, they are caught, they're either prevented from acting or they are caught very early. We know that there were numerous attempts by doctors, by paediatricians in this unit, to get Nurse Lucy Letby off that ward, to suspend her, because they were so concerned about what they thought she was doing. They were rebuffed again and again. There were some 10 opportunities when our managers could have acted. Do you think that, from what you know about this story now and from what your experiences has been as a health minister, that the NHS is capable of preventing this from happening again?
Well, I think there is one very distinctive aspect about this story, which is this long-standing problematic relationship between consultants and nurses on maternity wards. And this has been going on for years. We saw it in the Northwick Park scandal in 2002, in the Furness Hospital scandal in Morecambe Bay, in Shrewsbury, in East Kent. Time and again, this fractious relationship on maternity wards between the senior doctors and the nurses has led to suffering and deaths. And Jeremy Hunt, a couple of years ago, when he was chairman of the Health and Social Care Committee, did an investigation in our high rates of maternity death. And that report found that we had an additional 1,000 extra deaths of babies than, for instance, Sweden, if we had equal-sized populations. And at the root of many of the problems is this ideological and hierarchical problem between the caregivers, the primary caregivers, who are the nurses, who are quite reasonably very keen to support the mothers and to give them an opportunity for natural birth wherever possible. And the consultants, many of whom are men, who are there to give medical and clinical interventions. And those two groups, very, very often, as these reports all found out, have complex relationships.
But both sides think they know better. Look, we're midwives, we're the nurses. We know better. You sweep in, Mr. Doctor, with all your certificates telling you how brilliant you are, and you think you know better. But of course, they are more medically trained, and we know in midwife-led units, chances of the mum and the baby dying are higher. I mean, that's why I went to a major London teaching hospital to have my baby, because I knew I had a better chance of coming out alive. And this is the thing. We cannot allow the lives of babies, and mums, but babies is the way we're focusing on now, to ever be under question as a result of, some sort of power battle going on between nurses and doctors. But you think that's what was going on here, that senior figures... I'm not going to name names here, because I think focus on some names is unfair, because not unfair on them, but unfair on others who aren't being named. But every single person involved in this who did not act soon enough, and just to be careful of the precautionary principle, that this was about, a bunch of paediatricians claim there's something going on with one of our nurses, we're going to protect her. You think that was what was going on?
Well, I think everyone is struck by the way in which these very serious, plausible, reasonable consultants, there were 3 of them, all of whom gave documentary evidence, very clear graphs. You look at those tables of who was in the ward when the babies died. I mean, it's pretty incontrovertible.
The only person was Lucy Letby, yeah.
They were totally brushed off, demonised and humiliated, and they were made to apologise to someone who had been under scrutiny. I don't see any evidence that their actual behaviours were excessive or out of line, and yet the management came in really hard to slap them down and did not tune into what they were saying, the substance of what they were saying at all. That speaks to me of a broader cultural problem where 2 groups of people have just badly fallen out. And it is a feature of many, not all, and there are maternity wards up and down the country that are run wonderfully.
Exactly.
But as I say, there are too many instances where long-standing breakdowns have happened. In Shrewsbury, Donna Ockenden's report is equally heartbreaking, and it's all culture. It is all the breakdown between people of trust and of respect.
OK, but also, is it not an issue where, and again, what the doctors gave in evidence to this trial of these 10 months, where they were saying there was a concern about, we don't want police tape everywhere, we don't want to, we don't want to break down trust in the NHS, trust from patients. So a lot of it was about reputation rather than anything else. It defies belief to me, and I'm thinking to any other normal human being, that you would put the reputation of an institution, even if it was your employer, over and above the life of a baby. I think that's scary, and yet it does appear that time and time again, senior managers did that.
I agree, and in all many sorts of institutions do this at some point.
We've seen it in social services, we've seen it again and again.
We see it in Parliament. I mean, even in Parliament, which I love very much indeed, and as a parliamentarian, I'm a great champion, but we do it ourselves. But I agree, it is very weird the way that they refuse to bring in the police. Because when you bring in an authority like the police, rather than besmirching you, they can give you a clean bill of health. That is one way of closing down a debate and saying, right, we've done everything we should do, and they have cleared us of any problems.
Yeah.
To not bring in a higher authority just shows a lack of creativity and trust. And it does show that the management itself had the wrong mentality and the wrong culture. And quite rightly, they are going to be called into these inquiries and ask some tough questions.
Question I asked you earlier, but I didn't get a direct answer. But after that conversation, are you confident, as a former health minister, that the NHS management, NHS structures in place at the current time are capable of preventing this from happening again?
The NHS is 22,000 different organisations, many of which are brilliant, a lot of which are pretty good, and a few of which are failing. And this is a big failure. I mean, we should be under no doubt
Answer the
that
question.
This is another Northwick part. So no, not all of the 22,000 are brilliant, and some of them are a failure. And this is one of them. But as a broad group, I would still, if I had a baby tomorrow, I would happily take them to an NHS hospital.
Most people don't have a choice. I mean, I wouldn't say, oh, a private hospital would be safer. On the contrary, I think their profit motive would make them, somehow I would think they were less safe, actually, interestingly, and more concerned about that. In terms of what can be done, you know, we're going to have, look, you know, there's going to be this public inquiry. Realistically, you know as well as I do, it's going to end up being a statutory public inquiry because that's what the families are demanding. I don't know why the government didn't just announce that in the first place. I don't see also why these things can't be speeded up. I think it's pathetic that they take as long as they do. We need to have answers. There's going to be more police investigations. Some 30 babies, they now think other babies may have been harmed or attempted to be harmed by Lucy Letby. In terms of anything that can be done today to make sure that babies are just that bit safer from a malevolent, evil killer like Lucy Letby, what could be done?
Well, there's a nerdy point, Julia, which is, I hope I won't bore your viewers, but the way in which data was shared on these deaths, there was clearly a failure there.
Yeah.
They were not registered in the right kind of way. The data was not sent to the CQC. The CQC didn't get involved. That is a very common problem. Julia Cumberledge wrote a report on patient safety where she put a huge spotlight on this. I was the data minister. I was responsible for data as a minister. We simply aren't up to date, and there is too much fussiness and technological failure in this. We could be able to spot patterns.
Well, now that's it. I thought that was brought in after the Bristol Heart scandal, actually. Whenever there's an anomaly, any unit in any hospital that has an unusually high death rate or injury rate, instantly that is flagged on the data, and there should be an instant sort of external check.
Well, the vaginal mesh scandal, which went on 30 years, was the classic example. Time and again, in different parts of the country, there were hugely problematic issues with vaginal mesh, and yet we didn't spot the issue. And even when instinctively individuals could see the pattern from their own experience, they couldn't prove it because they didn't have access to the right data. That is crazy in a unified health system. One of the great advantages we have in the UK is that the NHS is a unified health system. And yet we should be the country that is able to do this.
Yeah, indeed. Lord Bethell, appreciate you joining us. Thank you very much. Very interesting insights there, former Conservative Health Minister.